Let's build a custom treatment plan together for this client. I'm Amani, licensed esthetician of over 7 years, and hyperpigmentation and clear skin is kind of my thing. So let's get into it. We're gonna start off with 3 different categories: product recommendations, lifestyle, and overall treatment options. I'm gonna go in reverse chronological order, and we're gonna go with the treatment options first. During maintenance facials, absolutely a huge fan of oxygen treatments and oxygen peels for no downtime, but also getting those skin cells turned over in a reasonable amount of time. As far as the heavy hitters, 2 chemical peels, 2 green peels, and 1 microneedling with PRP or exosomes. Make sure you get the neck. Chemical peels are obviously going to help lift the hyperpigmentation, gonna lift any uneven tones that we're seeing, and depending on the peel, it can also help with wrinkles and things like that, but we're mostly focused on pigmentation and making sure that we stop the breakouts where they are. 2 green peels. Green peels are gonna help lift and shed the skin as well, but the spicules that are in the green peel are going to penetrate the skin and cause a similar reaction to what you would have if you were getting microneedled. It's going to force your skin to create more collagen, which is what we need. We want our skin to heal itself. The PRP or in stem cells from the microneedling is going to help do that as well. It is going to just help your skin with those growth factors. It's going to help it rejuvenate and turn over much faster at a much faster rate, and it's going to force your skin to heal itself and force it to create more collagen, which is wonderful. It's going to create plumper skin with less wrinkles, potentially less or decreased hyperpigmentation, and obviously pitted acne scars, and the appearance of pores. But also the appearance of pores depends on hydration of the skin. Don't let anybody lie to you. Pores do not shrink. They don't have a muscle around them. Bible. Lifestyle, I would suggest obviously being mindful of the sushi intake, because high levels of iodine can cause your skin to break out, as well as wine, because sugars, alcohols, things like that can affect you internally. It's important that we're being mindful of what we're putting in as much as we're being mindful of what we're putting on outside of and topically. Ice rolling or red light LED therapy at home a couple times a week, but ice rolling either morning or night depending on your schedule to help with the inflammation. Pillowcase swap. I would say pillowcase swap at least 4 days instead of the standard 7, especially if you're having consistent breakouts or issues. We want to make sure that while we're sleeping, rejuvenating, that our skin has a safe place and a clean place to do so. And then of course, clean makeup brushes before every single usage. Get some Cinema Secrets, wipe that brush down, do your makeup. Do not use makeup wipes. Don't get me started. Product recommendations. A tyrosinase inhibitor. Tyrosinase inhibitors help to prevent new hyperpigmentation from coming to the surface, and that's exactly what we need to do to keep the skin clear and even. I like Glymed Plus as a line. They have the Living Cell Clarifier or the Daily Skin Clarifier, as well as the Pigment Brightening Serum. Pigment Brightening Serum has a small percentage of glycolic acid in there. If your skin is sensitive to glycolic, then don't go with that one, but if it isn't, it could be a good option to help lift what you already have on your skin and help get rid of the dark spots that you already have. Hypochlorous acid spray. This person is super active in between classes or right after a class, right after you get out of hot Pilates, hot yoga, cycling, whatever the case may be. We have to kill that bacteria. So hypochlorous acid spray is a must and a go-to. I would also say a hydrating toner and an essence. Hydrating toner may be like Skin Script, Cucumber Hydration Toner, or even the hydrating essence from Good Molecules, the Secure one. And another good toner could be the Milk one from Laneige. I've heard wonderful things about that one and I like how it feels. My last recommendation would be a chemical exfoliant. Physical exfoliants or things that are abrasive like beads or nets can be a bit much for people that are experiencing inflammation and breakouts. I would say the Beta Gel from Glymed Plus could be a great one as well. There are obviously other options out there. I'm just going with the ones that I'm super familiar with. And I think that with this treatment plan, this person could be clear and very satisfied with your skin, and also on the track to being glowy, bouncy, having less texture and less hyperpigmentation. And obviously they need to use their sunscreen. Let's not pretend like that's not even a factor. But yeah, bye.